musculoskeletal disorder. This is, I will update a little bit the mechanism and the physiological effect that
Excuse me,
relate to the,
Bukhari. Excuse me, Bukhari. Can I interrupt, please?
yeah, yeah.
Yeah. Uh, Let me to do praying because in Taiwan it's already dark. So I just need for 10 minutes to praying Maghrib because within 30 minutes it's already done for the Maghrib. Is it okay? After my
Yeah,
praying, I will come back to be your moderator.
okay, okay.
Okay. Thank you very much.
I may finish before 6, I think. Okay, and then we're gonna talk the breaking up prolonged sitting during work from home, and I will share a little bit about the ergonomic issue that I got from the IEA, or International Ergonomic Association, about the 7 practical tips guideline from the teleworking or home learning. Okay, for this period is the COVID-19, right? And many country, even in your country, the government have some strategy to take action or control the prevent of the COVID-19, right? And they have like a social distancing or the physical distancing in terms of the restrict the people and require the people to stay away and keep at least 2 meter distance from the other people, and have some strategy to lock down or quarantine. And they ask for do not gather in the group and stay out of the crowded place and avoid the mass gathering. And also the many places are closed, right? And facility or recreation center or exercise facility may be the close, and even the worker or people and many jobs have to change and transition from work at the office and work to back to work at home, and students also learning or study from the online. So the sedentariness and COVID-19 from lockdown is may, sorry, is maybe if people who stay at home or for prolonged stay at home maybe occur the event of the sedentariness and maybe increase the chronic disease risk, because when you stay at home, right, you just only laying down and sitting in front of the electronic gadgets or devices, for example, in terms of in front of the TV, smartphone or laptop. And this behavior of the prolonged sitting maybe can increase the cardiometabolic risk factor, or for example, the person who has the diabetes or who has a problem, maybe the level of glucose in their blood will be increased. For example, the hyperglycemia or hyperinsulinemia or other hormonal dysfunction. And from the last update, the report from the Bowes in 2020, they survey the physical activity of the people, and they report that every group of the people during COVID-19 decreases physical activity, both female and male and female also decrease. And the except in the group of the people who are exercise or uh, have the physical activity with the personal trainer still uh, the same physical activity, but a little bit decrease. But in other group decrease also because they stay at the home, just only the sitting and laying down. Okay, one group of the people that is is quite the main our customer at, right? And in terms of uh, our PT, the office worker is one one of the patient group that come to see the physical therapist with the office syndrome, right? And after COVID pandemic, they have to uh, move to work from home, and the study they report that this office worker is the one of the sitting in the position of sitting more than 70% of their work time, and they sit more than 8 hours per day, right? And this group of people is they have like sedentary behavior. Uh, the sedentary behavior, the definition is mean the any waking behavior that's characterized by energy expenditure less than 1.5 minutes while in a sitting or reclining posture. The this this one is the cut point score from the person who has the sedentary behavior, which means they when they're sitting, they use the energy expenditure less than 1.5 minutes. The MET is mean from the metabolic equivalent. Okay, and other word that they always use is the physical inactivity, which means that they have the insufficient physical activity as the WHO or World Health Organization recommendation. The WHO has recommended people to have the physical activity and the moderate PA more than 150 minutes per week, and vigorous means the harder more than 75 minutes per week. If you are stay at home or stay at the office workplace and the physical activity not reach to the recommend, you will be the group of the people who has a physical inactivity. And these two groups can be developed to the high prevalent. The report of the WHO found that they have high prevalence of NCD or non-communicable disease, and they have higher mortality rate. So for sitting and sedentary behavior, in terms of the metabolic equivalent, they have the study that they calculate. If you stay at home and just only viewing the TV or just typing on computer, the MET value just only 1.3, or typing just only 1.4 MET. And if you stay at home and just only sitting will be the sedentary behavior group. Yeah. And the global prevalence of NCD, and this is a data from the WHO. They report that the people around the world will be dead or uh, global death with the NCD around 57 million. And the top one is the cardiovascular disease, around 30%, 31%, the cancer and chronic respiratory disease. And interestingly is they report that more than 85% of the premature or premature deaths occur in low and middle income countries. Even in the Thailand and Indonesia, maybe in this group in the low and middle income country, and especially in the Southeast Asia region, in the report, the highest prevalence of the NCD deaths more than other region in the world. I have the data of the Indonesia. WHO has been report on the 2018. They uh, also the same trend with the WHO, which means the 35% of cardiovascular disease and people who are dead from NCD around 73%. It's quite a lot. And also in the Thailand, we have the same trend, but a little bit lower, but the same trend, the cardiovascular disease. So in the Indonesia, the WHO has been report that the major one is the tobacco use, right? The behavioral risk factor, but the highest one is high blood pressure, and the important one is the physical inactivity. Quite the main groups or the main risk factor that can improve or can have a higher risk of NCD. So from the physical activity and sedentary behavior, the person who at the beginning that they define the physical activity and sedentary behavior. Uh, they have some researcher or they have some study uh, from Bagarnia and Kubelman in 2018. Uh, they report that the person who have the sedentary behavior or sedentary status at the low sedentary behavior and high sedentary behavior and match with the physical activity status. If they have high physical activity status, it means they have physically active person. And if they have low physical activity status will be, it means the physical inactive. This group of people who have the low low sedentary behavior and physical active, they call the BCB group. For example, the worker or the person who stay at the office and uh, a lot of work to do and walk a lot of walking at the office will be in the group of BCB. But the person who have high sedentary, which means the sitting long long time at the office and physically active, this group will be defined as a sedentary exerciser, someone who stay at office and work in the sitting position all days. But after that, in the afternoon or after work, they go to running or practice their marathon running event, something like that. This group will be like a sedentary exerciser. Another group is light mover. This group is maybe a little bit risk factor for the for the non-communicable disease because they have physical inactive and they also have the low sedentary status. This group is called light mover. For example, the person who has stay at work and then after that they back to home and they do nothing, just only work light activity at home. They call the light mover. And the last group they call the couch potato. This group is the highest risk factor for the NCD and the highest NCD, and they call the couch potato, which means the person who had high sedentary behavior at work, and after that, they also physical inactive, which means after they go back to home and just only stay at the couch and viewing TV all the day and night, and after that go to bed. Uh, these two group is highest prevalent of the NCD. So and after that, this group quite a lot of sitting, and these two group BCB and sedentary exercise also uh, a lot of sitting at work, but after that they have some activity. These two group we gonna focus to like perform some intervention or something to help them. And these two group quite they come to see the physiotherapist and come to see the doctor because their behavior. Okay, and I will talk a little bit about the mechanism of too much sitting. Uh, I have the short video around 4 minutes about the prolonged sitting and the effect of health.
Right now, you're probably sitting down to watch this video, and staying seated for a few minutes to view it is probably okay. But the longer you stay put, the more agitated your body becomes. It sits there counting down the moments until you stand up again and take it for a walk. That may sound ridiculous. Our bodies love to sit, right? Not really. Sure, sitting for brief periods can help us recover from stress or recuperate from exercise. But nowadays, our lifestyles make us sit much more than we move around, and our bodies simply aren't built for such a sedentary existence. In fact, just the opposite is true. The human body is built to move, and you can see evidence of that in the way it's structured. Inside us are over 360 joints and about 700 skeletal muscles that enable easy, fluid motion. The body's unique physical structure gives us the ability to stand up straight against the pull of gravity. Our blood depends on us moving around to be able to circulate properly. Our nerve cells benefit from movement, and our skin is elastic, meaning it molds to our motions. So if every inch of the body is ready and waiting for you to move, what happens when you just don't? Let's start with the backbone of the problem, literally. Your spine is a long structure made of bones and the cartilage discs that sit between them. Joints, muscles, and ligaments that are attached to the bones hold it all together. A common way of sitting is with a curved back and slumped shoulders, a position that puts uneven pressure on your spine. Over time, this causes wear and tear in your spinal discs, overworks certain ligaments and joints, and puts strain on muscles that stretch to accommodate your back's curved position. This hunched shape also shrinks your chest cavity while you sit, meaning your lungs have less space to expand into when you breathe. That's a problem because it temporarily limits the amount of oxygen that fills your lungs and filters into your blood. Around the skeleton are the muscles, nerves, arteries, and veins that form the body's soft tissue layers. The very act of sitting squashes, pressurizes, and compresses, and these more delicate tissues really feel the brunt. Have you ever experienced numbness and swelling in your limbs when you sit? In areas that are the most compressed, your nerves, arteries, and veins can become blocked, which limits nerve supply, causing the numbness, and reduces blood flow in your limbs, causing them to swell. Sitting for long periods also temporarily deactivates lipoprotein lipase, a special enzyme in the walls of blood capillaries that breaks down fats in the blood. So when you sit, you're not burning fat nearly as well as when you move around. What effect does all of this stasis have on the brain? Most of the time, you probably sit down to use your brain, but ironically, lengthy periods of sitting actually run counter to this goal. Being stationary reduces blood flow and the amount of oxygen entering your bloodstream through your lungs. Your brain requires both of those things to remain alert, so your concentration levels will most likely dip as your brain activity slows. Unfortunately, the ill effects of being seated don't only exist in the short term. Recent studies have found that sitting for long periods is linked with some types of cancers and heart disease and can contribute to diabetes, kidney, and liver problems. In fact, researchers have worked out that worldwide, inactivity causes about 9% of premature deaths a year. That's over 5 million people. So what seems like such a harmless habit actually has the power to change our health. But luckily, the solutions to this mounting threat are simple and intuitive. When you have no choice but to sit, try switching the slouch for a straighter spine. And when you don't have to be bound to your seat, aim to move around much more, perhaps by setting a reminder to yourself to get up every half hour. But mostly, just appreciate that bodies are built for motion, not for stillness. In fact, since the video's almost over, why not stand up and stretch right now? Treat your body to a walk. It'll thank you later.
Okay, so I'm so sorry for the connection, a little bit strict of the presentation. So from the video presentation, they report that when you are prolonged sitting, and it will be effect to your body, because your body like built to movement, but your job or your work, they tend to be like a sitting and prolonged sitting uh, along the day, around 8 hours per day. And then the from the study by Chandra Sekaran in 2020, they also report sedentariness and chronic disease in during COVID-19 lockdown. And they have uh, this infographic that relation between the excessive sitting and possible biological mechanism of the chronic disease. If you see in the figure, when you prolong sit work, and the first problem is the poor muscle activity, and this can reduce the energy expenditure. And after that, maybe affect to the other organ of the function, for example, the endothelial dysfunction, and poor shear stress of the vascular, and it will be result to the dyslipidemia or thromboembolism or something like thrombosis. And it also occur to the poor cerebral perfusion and reduced conduction velocity. Your brain might be thinking about that something not good, and they also affect to the increase the sympathetic nervous system activity and increase the inflammation. And in each domain, or in each the potential physiology behind the sitting that lead to the chronic disease, it will be result to the possible chronic disease, for example, the obesity and diabetes, or you can occur the back pain or neck pain, and maybe occur the hypertension. As, as I showed on the previous slide, that the highest prevalence of the NCD in the Indonesia around hypertension. Okay, so not only for the vascular or cardiometabolic health, the prolonged sitting can be affect to the work-related musculoskeletal disorders, which mean the musculoskeletal disorder that occur from your work. So when you prolong sit work or prolong sitting time, even in your office work or your home, because you have to work, even your stay at home, right? And when you prolong sit work, your physical activity will be decreased, and it will be increase the sedentary behavior. And this will be combined, if they combined with the inappropriate ergonomics of the workstation, and you're sitting in awkward posture. This position in Thailand, I also found some worker that they shift from the workplace and back to work their home. They don't have any the workplace furniture, or for example the table or the good chair, something like that, and they have to sit on the floor and work with the like a small table at their home. This inappropriate ergonomic workstation or sitting in awkward posture might be uh, increase the static loading on the muscle, tendon, or joint or soft tissues, and it will be change the muscle activation pattern. I will show the next if the muscle activation pattern change, what it happened. And after that, injury will be occurred to the muscle. If they cannot cure or they sit along the day, after that inflammation will be respond, like you feel pain, aging, or discomfort and fatigue, something like that. And if you have to work for maybe in this position for 2 months or 3 months during the COVID-19 at your home with a small days, right? The injury of the musculoskeletal disorder will be appear. For example, if you have the localized tension or muscle strain, soft tissue damage, impair motor control and coordination, and then neck pain or back pain and shoulder pain will be occur to the worker. And after that, they will be come to us, see the physiotherapist to treatment for them. So if we can stop somewhere, they can like help them to uh, don't have like a neck pain or back pain. So for the mechanism that why your prolonged sitting and musculoskeletal disorder, the study they found, like if you ever ever see about the sitting position and the disc pressure, prolonged sitting and lean forward maybe uh, increase the low back discomfort, because when we sitting in the prolonged sit work and you forward bending, right, and pelvic will be tilt forward and CG chip in front of the ischial tuberosity and the trunk forward bending, maybe lower back pain discomfort will be increased and back muscle activity also increase. And when you stay for this posture for long period of time, localized tension will be occur in the muscle and fatigue will be produced. For example, the paraspinal or core muscle, when you prolong sit work and it have to like a contraction in the static contraction for long period of time, uh, it will be like a reduced muscular support when it fatigue, right? And will be paraspinal or core muscle is located at near the spine, and if the reduced muscular support to the spine, the load will be on the ligament and intervertebral disc. So when it combined with the like a slump sitting, pelvis forward rotation, increased lordotic of lumbar spine, the low back pain will be occur, and worker will be come to see the physiotherapist. And so the prolonged sitting in this posture may be increase the development of low back pain. So we can help them like a sitting posture adjust or educate them to adjust the sitting posture. Okay, and sorry. Another one is the prolonged sitting work not only for not only affect with the musculoskeleton, but also affect to the mental health. When you have like a work in front of the computer, right? When you stay at home or stay at office, work in front of the VDT, which means the that visual display terminal or computer. And when you're sitting for a prolonged period of time, the physical demand will be increased with, and you like a biomechanical strain or physical load will be occur on your soft tissue or spinal. And after that, if the tissue damage or they detect the sensation, some fatigue or feeling discomfort, and if this does not cure, and labeling attribution maybe the cumulative trauma disorder, like a cumulative every day. After that, the musculoskeletal outcome or musculoskeletal disorder will be occur. Uh, it's not only for the musculoskeleton, but the psychological strain or mental stress is also affect to the musculoskeleton. For example, if you have like a stress at your work, it will be affect to the musculoskeleton also. Another one is the individual factor. Individual factor will be can increase the biomechanical strain and occur the musculoskeletal outcome. For example, if you like shift work from the office and go back to work at home, you have a lot of work and you have a lot of new thing to learn. And if you have like a new thing to learn how to use the Zoom, how to use the online equipment, you have to concentrate and you have to focus on in front of the computer, and it maybe can increase the biomechanical strain and occur the musculoskeletal disorder. So this mechanism can show in our patient that they come to see the physiotherapist, someone who has like a stress and someone who have to learn a new thing with learning from home and a lot of work, and they come to see us with the musculoskeletal disorder. We can like assessment them not only for the location of pain, but other factor maybe affect to them, like they have to sitting for prolonged period of time. Okay. Not only for the musculoskeleton, but COVID-19 pandemic, and we have to stay at home, also affect to the inactivity of the cardiovascular health. As you see in this picture, uh, this is a normal activity. And after we like a lockdown at home isolation, everyone stay at home, and the physical inactivity and sedentary behavior, just only sitting in front of the TV or sitting reading a book. This behavior will be affect to the cardiac atrophy or dysfunction or vascular remodeling, and increase the arterial stiffness and affect to the endothelial dysfunction and increase the oxidative stress and inflammation or cardiovascular profile. For example, dyslipidemia or insulin, and increased risk of cardiovascular mortality. And why the just only sitting and affect to the cardiovascular? They have some explanation mechanism that study by Carter and college in 2017. If you see in in this picture, this is the represent the artery in our body. In A is represent the artery during physical active, or you are walking and you go to exercise and as normally. And B is the represent the you are prolonged sit work at home or at the office. When you prolong sit work, this is the artery or blood vessel. The outer layer is the endothelial cell, right? And inner is the lumen, like a tube for blood flow. And this is the endothelial cell and the smooth muscle cell, outermost layer. When you are walking or physical active, blood flow is higher, right, than the shear stress. And the wall will be like a lot, and this shear stress can be induced the NO is mean nitric oxide. This nitric oxide, it can induce the relaxation of the muscle, smooth muscle of the vessel. So the person who are active, the vascular will be like a compliance or flexibility. It means flexible, better than the person who are the prolonged sitting. If you see the prolonged sitting, why the person who are prolonged sit, occur the cardiovascular disease and vascular stiffness, because when they are uh, prolonged sit, right, the shear stress on the tube in the vascular decrease. When the shear stress is decreased, the nitric oxide does not function. But the other thing is the ET1 or endothelin 1. This one is the bad thing. When they release, it can be like a induce for constriction to the smooth muscle. When the muscle, smooth muscle cell constriction, it can be like a our vascular will be like a thickness, and flexibility is decreased. So when your vascular thickness, and it will be like occur the vascular stiffness and inflammation or insulin resistant or disease will be follow. This is the reason why when you prolong seat work, the vascular will be dysfunction. And after that, the result that follow is mean your body mass index will be increased, your cardiorespiratory fitness also increase. This one is you can see the person like if you are the beginner for running something, right, before the COVID, and after you prolong seat work at home or for lockdown just 3 months, and after that you go back to practice, and cardiorespiratory fitness of yourself is like a decrease. Also blood pressure increase because the vascular is thickness, insulin resistance increase, and blood lipid profile will be increased also. And other mechanism that they also update from the Bolden and Davy in 2019, they explain why the people or person who are prolonged sit work or sitting along the day or at home, why they have like a chronic sedentary behavior and NCD days more than the person who are active. Because when you in this picture, they like explain the mechanism of metabolic risk factors. When you active like other function, MPK activation, which means the activated protein kinase. This MPK activation is the one that like a glucose metabolism. If it lack of MPK activation, the glucose metabolism will be have some problem. And when the glucose metabolism have the problems, glucose in your bloodstream, like your blood vessel, have a lot of glucose. And in our body, they have one process we call de novo lipogenesis. This process is mean lipogenesis. It means they can uh, change from the glucose to the adipose tissue. So after that, the glucose that in your bloodstream will be changed to the adipose tissue, and your fat, adipose means fat tissue, increasing. When the adipose tissue increase, they also have like NEF efflux, we call non-esterified fatty acid. This fatty acid will be uh, have the process in the liver, and if they have a lot of NEFA flux, the liver cannot metabolize or cannot function good or better. The lipoprotein or very low lipoprotein density or LDL will be export higher, and the liver triglyceride also increase. This is the reason why when you prolong sit work, and why the just only sitting at home or at work, and why the the triglyceride, or if you're like a annual checkup, right? You collect blood at the hospital, and after that, the score of the LDL show the higher, yeah, because the some effect from the adipose tissue and glucose. And if you are the active person, or you just waking and walking or have some activity, this function may be normal, and liver triglyceride or blood profile may be normal. Okay. Not only for the metabolic profile, but oh, sorry. But physical inactivity, which means your activity not reached to the recommendation by WHO of the 150 minutes per week. When you prolong sitting, the process of the inflammation and process of anabolic resistance will be affect to the MPS, which means the muscle protein synthesis. It can decrease the muscle protein synthesis, and they also have the process that increase the muscle protein breakdown. That's why if you are inactive, the skeletal muscle will be atrophy, and it will be related to the other factors also. This is the problems or the mechanism of the our body when we have like a prolonged sitting. And if you are too much sitting, this inflammation or this function will be occur in your body. So in study of the Pasiha, the same picture at the previous, they report that during COVID-19 pandemic and physical activity, if you are stay at home and you have some like a physical activity in your home, or the worker or person who like a shift work from the office and back to the home, have some physical activity, it can benefit for you to like have the cardiovascular health, improvement of the fitness and exercise capacity, and can prevent the sedentary behavior and cardiovascular function. And you have like a better control of the cardiovascular risk factor, and primary and secondary prevention of cardiovascular disease, and the reduced risk of cardiovascular mortality, especially in the person who are like elderly or older, elderly in your home. If they just only stay at home and sitting on the sofa and or couch, it will be increase the mortality rate in from the NCD. From this reason that we have like some intervention or something that we like provide them and recommend them, not only the office worker but also the person who are prolonged sit work, to have like a breaking up prolonged sitting. Breaking up prolonged sitting, which means that we recommend them to break from prolonged sit work, and we have like a many things to to provide for them. Nowadays, the breaking up prolonged sitting, it means the we require them to have like a physical activity and exercise break, and we help them to encouraging the physical activity and reduce sedentary behavior, and will be like an effect to health outcome. What is the break? Break, which means you uh, stop working or stop from this prolonged sitting, and after that you just have the activity. From the study of the Wong in 2018, they define the types of activity breaks for the person or for the office worker or the person who are like a prolonged sit work. They have three types of break that we can recommend for our patient or our clients. Like some PTs, they have the patient, right, who are the office worker, and we can recommend them to like perform the active break. The type of break that they conclude, from their conclusion, they got four types. First is the active break with the postural change, which means when you prolong sit work and after that you break sitting, and break with the you have to change the posture from sitting to standing, just just is standing or walking, or you have to perform a specific movement, or you have like a perform an exercise. Uh, the second one is you can break like a active break without postural change. This group is mean that you can break sitting, break from work, and after that you perform specific movement or exercise of the low back or lower limb in the sitting position. It's different from the first group. First group is that from sitting to standing and perform activity, right? And the second group is like a active break, and you just exercise while you are in the sitting position. And the third group is like a just only standing break. Standing break is mean you break and you just change position from sit to stand, just only stand. And the last one is passive break. Passive break is mean that you just only break and leave from your computer. You just sit and relax, and you like take a rest from your eye or vision that you have the like a look on the screen for long period of time, and you just close your eyes and just relax. This one is a type of active break, passive break. Sorry. So this intervention, they many research they report the effective and can help to improve the cardiovascular and can reduce the total sitting time. This is the example of type of break sitting. If you see the left corner, this is the example of the sit stand workstation. When you are like sitting for a long period of time, but you have to continue to work, some equipment or some days, some furniture can adjust to higher, and you can stand for work. This is like a change position sitting from standing, sit to stand. Another one you can like some office have the ergometer cycling and working and cycling together, or treadmill walking and work together, or you can just stretching exercise or general active exercise. There are a lot of type of break. It depends on the severity, or the depend on your preference. Your if you like to walk or just sit stand, you can perform the stretching, the break. Or someone who has like a severity of the cardiometabolic risk factor, you can recommend them to higher level of moderate to vigorous physical activity break, for example, cycling or treadmill walking during break. How long for break? Nowadays, they still have no what we call no prescription, no exactly prescription for how long to break, but they can define in the T groups for a long break, which means the more than 15-minute break, at least 2 times per day. We call the long break, or just only lunch break, 1 hour lunch break. They also call the long break. Second group is we call short break. Short break, which means that you have to break 5 minutes every 30 minutes or 1 hour prolonged seat work. This means when you're sitting for work for 1 hour, after that you just break 5 minutes. And the third group we call micro breaks. We call micro break, which means the break 30 seconds every 15 minutes. The breaking up prolonged sitting, they have a lot of study. And first, the study by Kalinsky, they report that the black one is the conventional break, and the gray one is the supplementary break. Conventional break, which means they break 15 minutes at the morning, and after that, lunch break, and after that, break 15 minutes in the afternoon, 3 times per day. And supplementary break, which means they perform conventional break, and after that they plus 5 minutes every 1 hour. They report that the supplementary break can like decrease the discomfort of the muscle. Discomfort, we mean you feel like a discomfort on your muscle and can decrease. So the short break will be better than long break. Another study by Bausi, they also report the break sitting. They perform 10-minute break and 5-minute break from prolonged sitting of 30 minutes and micro break every 15 minutes. They report that the discomfort is lower in the micro break. The other one studied by Chalayan Desha in 2017, they report the prevalence of the non-communicable disease and cardiometabolic risk factor. And this study, they like provide the active break, and they found that the person who are the worker who took break or active break less than 2 times per day, they have 1.5 times the risk of NCD. But the worker who take a break or active break more than 2 times per day, it can reduce the risk of NCD or non-communicable disease up to 41%. Especially the score of the hypertension and hyperlipidemia will be decreased. And they recommend that break sitting may be important public health and clinical intervention strategy for reducing cardiovascular risk and health profession. For example, our PT or physical therapist can recommend them like breaking up from prolonged sitting. It will be better than you continue to work and without any breaks. So other study by the Healy, they also perform like a cross-sectional study, and they report that the adult who prolong sedentary time or sit all along the day for work, they have like a poorer cardiometabolic risk. Cardiometabolic risk, which means like a blood profile or the vascular function, as I said in the previous. The sedentary person has poorer cardiometabolic risk when compared with the person who have the rest break sedentary time, especially the score of the waist circumference, BMI, triglyceride, and 2-hour plasma glucose. Okay. And other study, they like perform break, prolonged sitting time with short hourly with a moderate physical activity. And they found when you provide or recommend them to break with the moderate intensity physical activity. In this study, I think they use the cycling during break. Break with you cycling 5 minutes, and after that they measure every hour. They collect the data for 8 hours per day, and they found that if you break from prolonged sitting, can increase the cardiometabolic risk factors in the healthy young adults. They report like a total cholesterol and has changed. This means the percent change has been changed, decrease, and glucose or C-peptide. And other study, they compare you in the white one, which mean in uninterrupted sitting, which mean that you have prolonged cease work along the day, and the gray one is sitting and you have light intensity activity break, and black one is you have sitting in moderate intensity activity break. The study, they report like if you break sitting with the light or moderate intensity activity break, it can decrease or lower the plasma glucose and the serum insulin. This is the confirmed that the break sitting may be important in public health and clinical intervention strategy for like reducing cardiovascular risk. Other one for musculoskeletal discomfort. When you prolong seat work, the study they found that before work from this graph, if you see the data before they work, this is the level of muscle discomfort. Muscle discomfort will be accumulate and increase every hour of your work, right? In the before work, just only 0.4, and after that you work in the morning 1, morning 2, and morning 3 hour there will be like an increase, and after that it decrease in the morning day 3. During this period is like a lunch break, and after that you go back to work at your home or at your office, and discomfort will be accumulate and increase again. This is the reason why we have to break a little bit during every hour, because the break sitting can like decrease the accumulation effect of the musculoskeletal discomfort, and the it will be better just especially in the low back pain is the highest the musculoskeletal discomfort. If you have like a break sitting during the day, it will be better for your health or for your client, for your patient health. Okay, for the next one, the last update one, they like not only for like a break with the walking or standing, they try to perform the break sitting with the exercise. This is done by the PT because our strength is the exercise, right? PT, and they try to develop the exercise and give the patient or client to exercise during break by perform the stretching exercise. Uh, for example, in this picture, the work period for 30 minutes, and after that they break just only 5 minutes, and after that work for 30 minutes and break 5 minutes, and then the their study and perform the exercise, and they report that taking break every 30 minutes, total of 2 hours, can decrease the musculoskeletal discomfort and can like restore the postural immobility, like a restoration of the spine position or your spinal, your paraspinal muscle or your core muscle, like a realignment. Uh, and and they suggest that workstation exercise may be beneficial. And this is the example of the exercise. Some study by men, they're trying to develop like a exercise at workstation, uh, like just in the sitting position, in standing position, not only the lower limb but upper limb. Like you have time for 5 minutes and break and exercise at your home, like this, or neck exercise, or chair exercise, like increase the core muscle or abdominal muscle, something like this, or lower limb exercise. And study by Shariat, they also developed the exercise in a chair during breaking period. And the study, interesting, they report that when you have the breaking up prolonged sitting, it can decrease the neck pain when compared with the control group that did not exercise. Neck pain and shoulder pain also decrease, and low back pain also decrease. So this is the reason of the break sitting from the prolonged seat work. It will be like a good for your cardiometabolic risk factor and musculoskeletal disorder. And for the last one, the breaking up prolonged sitting is the one of the ergonomic tips, right? And Ergonomic is mean the side of work, right? The person relationship with the work, with the environment, and how you have like a way to work smart, not work harder. And in terms of economics, uh, they can like a benefit for your clients, your health, because when you perform good working position or good working ergonomics, like a sitting position, or you have a little bit break, and your work, uh, your job, it will be safer, and you're like a fewer injury, and the work efficiency or work productivity will be better, and can improve the work quality. And if you have like a good economy, it can like decrease the error of human errors. So the economics of PT or physical therapists, and our roles with the economic, we can like uh, we can do in many domains. For example, the assessment and evaluation. We also can assessment for the problems of the clients, of the patient that come to see us. And after that, we can also management like on-site physical therapy at home or at the office or on site. We can like treatment or rehabilitation, and also can help them to like help promotion or prevention. So if the PT understand and sorry, if the client understand and our PT have like a good role model of the ergonomics, it can help like a cost saving of the employee, and can decrease the work-related musculoskeletal disorder in our clinics or in our hospital. And in the work side, they also can increase the productivity, and they can return to work happily and decrease the absenteeism. So the Economics Association, or IEA, International Economic Association, they they also have like ergonomic tips, 7 tips of the ergonomic for teleworking or home learning using the tablet or smartphone. These practical tips they launched last month, and now they're already translated into 4 languages, like Chinese, Japanese, and Thai language, and some
Bukhari,
Malaysian.
excuse
Yeah.
me, Bukhari, we have only 3 minutes left.
Okay. Nearly finished.
Okay.
Um, uh, this is the QR code. I will leave this QR code, and you can download it. Oh, sorry, download, and you can read. I will leave after this. Okay, the first tip is just you practice the 20-20-20 rules when using the digital devices. Uh, if you work every 20 minutes, and after that you're taking breaks, so 20 seconds, and then you look at our object away from 20 feet, it means the rule of 20-20. The tip number 2, and they suggest us to alternate between sitting and standing position when using the digital devices, and alternate like a sit stand position. For example, like this. Okay. And tip number 3, and they suggest us to support the arm holding when you use smartphone, in other hand, in order to keep your neck straight. And the tip number 4, and they suggest us to use stand or case or tablet smartphone, so trying to keep your eye level and like a neck, your neck straight. And tip number 5, they suggest us to use the landscape orientation in terms of as standard when you're browsing the watching content on the digital device. the landscape orientation will be like a bigger fonts or screen. And number 6 is you use the stop, flop, drop technique, which means when you text already texting or sending email, and after that you just place your smartphone down, and after that you pull chin in like a chin in exercise for restore your neck as a micro pause. And the last tip is you use the external keyboard when you're texting a tablet or smartphone for long period of time. This increase in terms of the help your hand function or workload on your hand will be better than your typing on the screen, something like that. This is 7 tips that I will leave it and share to you to like can practice and introduce and suggest for your patient or your clients in Indonesia, something like this. Okay, it's the same. The other thing is the working environment. Something is temperature or clean air will be important too. Okay, thank you very much uh, for your attention. This is my presentation about this, the breaking up sitting and the effect of the breaking up from prolonged sitting.
Okay,
Thank you
thank
very
you,
much. Yeah,
thank you very much, Mr. Bukhari. So due to the limitation of time, because we have only actually only we have 30 minutes left, 30
yeah,
minutes
yeah.
left for discussion. So anyone has any questions for Mr. Bukhari?
Anyone have like a question? I maybe finish
Six, right, right.
before break. Yeah,
Yeah, we
it's
can finish
okay,
before
right?
break. Okay, it's okay. Doesn't
And
matter.
after that, we can go to prayer for
Yep,
Margaret.
yep, yep. So
Any question?
I have some. I don't know. Maybe I missed some your slides. So this is
Yeah.
kind of the my questions. Like, uh, do you have numbers about the increased numbers during the work from home or the pandemics, about the increasing numbers of the back pains, the increasing numbers of the chronic disease, or
Now,
and the second one, my question is how big the effect, how big the effect if we are working on the home during the pandemic, if we do the kind of the exercise like usage or the intervention like usage, because uh, in Taiwan is normal, everything is normal, but if my colleagues from Japan is quite hard if make some exercise in during work from home because their home is quite small. So how big
yeah.
the effect if we just doing the intervention like usage?
How big is mean the frequency, right? Or
To prevent, to
intensity
prevent,
or
how big the effect to prevent like for the uh, chronic disease or back pain. Maybe I missed some slides because I just go to bedroom.
the how big is mean the prescription, right?
Right,
And
right, right, right.
now actually nowadays they don't have like the exactly number or the number of like a frequency or intensity, but many evidence they suggest at least like a 3 times a week or
Mm,
no 3 times a day you have to break, or if you can like perform the break
three times a
every
day, right?
hour. Yeah,
Three times a day.
yeah,
Mm,
but the exactly number still don't have because
mm,
depend on your condition,
yeah,
also
yeah.
your condition. If you just a healthy normal people, like just 3 times is okay, or if you have like a condition with back pain or
Mm.
neck pain, you have to like consult the expert first
Okay,
because some exercise maybe affect something to your health.
okay, I got it.
Yeah.
There is no questions from Zoom group chat because maybe because in Indonesia is time praying for the Maghrib. So uh, we are really
Okay.
appreciate that you can share interesting topic for the PT in Indonesia. And thank you
Yes.
very much, Mr. Bukhari, as token of
Thank
our
you.
appreciation to our guest speaker for your time, for your valuable contribution. So have a nice weekend and take care. We move back to Mrs. Nina.
Thank you very much. Thank
Thank
you
you
very
very much.
much.
Take care.
Yeah.
Thank you very much, Mr. Rahmat Rosadi. We also would thank to the wonderful people who spoke and performed on today international seminar, especially to Mr. Johan Haras who keep stay with us until now. Terima kasih Pak Johan, semangat Bapak selalu menjadi inspirasi kami semua. We apologize if there were mistakes. Thank you for your time and attention. And now we will close the conference for today, and we will see you again tomorrow in the second day of CMFI International Seminars at 8:30 EM. So have a good Saturday night, everyone. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.